Take a minute and walk in someone else's moccasins. An early 30-something single man called me before coming into the clinic to explain he had no insurance but knew his kidneys were failing. He'd lost his job, lost his insurance, and he couldn't find affordable insurance once they heard he had a familial polycystic kidney problem. Another patient was a 40-something woman who had been diagnosed with ovarian cancer, treated, thought she was cured, and now, 6 years later, was having symptoms of recurrence. Her husband had switched jobs in the last few years, and their new health insurance put a rider on her coverage so that it wouldn't pay for anything related to ovarian cancer. These are real stories, a real crisis, clarifying why insurance reform was needed. Here in the U.S., up until the Patient Protection and Affordable Care Act, or ACA, insurance companies had to compete in the marketplace by avoiding cases which would expose them to significant expense. If an insurance company covered too many people with chronic illness, that insurance company would either have to raise their rates so high that no one would buy their product, or they would go bankrupt in short order. The system in the U.S. had evolved into one that made it difficult to cover the very people who needed insurance the most. Indeed, it was time for our political leaders to either reform insurance or to develop a single-payer universal insurance which would virtually eliminate the health care insurance industry as we know it today. Some would call this an improvement, and some would say this would be very bad. Now we have the ACA, but indeed there would be problems with this new healthcare law, including the healthcare.gov website sign-up glitch, the inadequate penalty for not being insured, the confusion that will follow for newly insured, the inadequate coverage for the working poor in South Dakota and 20 other states where Medicaid coverage has not yet expanded, and the predicted flood of new patients who will be trying to find a primary care doctor instead of using the emergency room for their primary care. Despite these and more problems, now my patients with kidney disease and ovarian cancer can be adequately insured. There will be problems to fix and details to change, but insurance reform was the right thing to do.